talking on different topics like how to manage or what are the golden period or golden hour when the patient reach and what should be the early management after road traffic accident. So the first thing is immediate after accident, the golden rule is patient should reach the center or any nearby hospital where primary care should be given, which we also call as ATLS, Advanced Trauma Life Support System, which is A, B, C, and D. First is airway, second is breathing, third most important is circulation. So first thing to be secured is airway. In majority of time after accident, patient is having cervical injury, which is most common in bike riders or in a car crash. When the patient come, they are not having limb injuries. They have majority of cases. Sometimes they have head injuries. Sometimes they have neck injuries or spinal cord injuries. In many centers or many people doesn't know, and they shift the people in, move the patient in not a proper position. That causes more fatality and more mortality in these patients. So while shifting also, we have encountered that in many cases while shifting the patient when coming to the center, we see that patient has been brought dead. That is because of not proper transportation, which is the basic thing to be learned for proper shifting of patient from when they are referring one patient from the trauma position site to the hospital. So first thing is proper transport. You have to identify which area is injured. Suppose nothing, patient is conscious, but first thing after accident, you should secure the neck and spinal cord to be examined first. So if there is any pain or any patient is having pain in the neck or back region, so he should not be moved abruptly. He should be placed supine on the board, strapped to it, and then he should be transferred. So this is the first basic thing. Second thing to be see is where airway is maintained or not. Sometimes when patient is having a fall history or accident, so there are some obstruction in the nose and oral cavity, and patient is difficulty in breathing. So first thing is securing the airway. So securing the airway can save life. Breathing, you have to see the breathing. If there is difficulty in breathing, then you should give oxygen and then shift the patient. Then third is circulation. See, circulation means you have to see whether peripheral pulses are there or not. You should first see vitals, BP and pulse should be checked in the primary area. If there is any bleeding area, patient is having bleeding or hemorrhage is there, you have to secure it, you have to tight it, bandage it, splint it, and then shift the patient. So this is all regarding the shifting and primary care to the patient when there is an accident. So what we are seeing in early diagnosis, proper transport of the patient, which is most important. And third is golden period. Golden period is what? The proper timingly shifting of patient. You have to act fast. Within the first few hours is most crucial for the patient for giving best outcome. If you are delaying the golden period, means there is increase in chance of mortality or morbidity for that patient. For example, if a patient is having an accident, if he is having any bleeding, and if you are delaying in shifting, or if a patient is having open wound, which is most commonly seen nowadays because of majority of patients are having road traffic accident, which is high energy trauma. Most common is bike accident or car crash, where there is an open fracture, the upper limb or lower limb, because of this trauma where they are crashing on the ground and mopped like this, and then there is open fracture. Open fracture means bone is being exposed to the wound and it is soiled and dirty and with bleeding wound. So those patients, early care is required to prevent that limb and give functional limb. Otherwise, if there is delay in treatment, there is very high chance of infection, and it may also lead to amputation of the limb, either upper or lower limb.
Hi, good evening. We've gathered today here to talk and discuss about road safety program. Unfortunately, accidents do happen, but we should also be aware about what our responsibilities are if we come across an accident case in front of us. how we can mobilize our resources, whatever we have, in better management of these accident victims right at the site of accident, and also how to transport them very safely to the nearest trauma centers. And then, of course, you should also be aware what happens afterwards in the trauma center. So there's a role to be played by every common person, and also every department, whether it's a fire safety department or the police or the traffic guards. So all of them have got a role to play, and of course, some roles will be played by other helpers from in the area. But doctors, nurses, and the technicians and the emergency departments will have the major role to play here. There is no doubt that the accident and emergencies are increasing. We have also seen a different trend of the accidents. Before, we would see more accidents which were low velocity. Now we see high velocity because speeds are increasing, roads are getting bigger, roads are getting broader, and the traffic is moving faster. So I think this is an unfortunate corollary to this development project. We will see this more and more. We will also see more accidents from fall of heights, because now we have very big buildings coming up. So you'll also see people falling from height. People have gone into sports, into adventure sports. So you will see many accidents happen from the sporting point of view. So all these are going to happen. And unfortunately, when these things happen, we should be ready with infrastructure. Also, what we are doing, there's a lot of new developments which are happening both in initial management and also in the final management. I'll let my colleague Dr. Kushava talk about those aspects.
Initial management, which is most important. Once the patient is reaching the trauma care, the first thing which I have already explained, the first thing to be done is according to the ATLS score, that's airway, breathing, circulation, then primary screening of the patient. What is the primary scrutiny of the patient is being done. Then after care is done by the trauma surgeon, what as sir has explained, that all the teams should be present. If the patient is having abdominal injuries, your general surgeon should take care of it. If his patient is having a cardiac injury or a thoracic injury, then your cardiac surgeon should be there available. And trauma surgeon, as upper limb and lower limb surgeries are required, the trauma surgeons take the role.